There are several factors that would influence the decision. Obviously, it's a decision they make in partnership with their patient, and I think there are a number of factors. The first is, how is the patient doing on their current therapy, and is the patient satisfied with their therapy from an efficacy point of view, or tolerability point of view, and also even a risk profile point of view. I think the second question is, if the patient is actually still having relapses or disease activity, they need to think about changing. I think another characteristic is the patient's desires, their lifestyle, etc. Do they want to use a drug that is given orally or a drug that is given by injection or infusion? And obviously there are many factors that influence, but it's a balance of all of those factors that will help physicians and patients decide on the optimal drug therapy, particularly if they feel that their current therapy is not meeting their needs. Well, I think in general, I think any neurologist will tell you, or any physician treating patients with a chronic disease, or any patient with a chronic disease, you grow familiar. If you have to use a drug continuously and you anticipate using it for the rest of your life, you want to be sure that you're comfortable with that drug, and you basically, as you say yourself, you get comfortable with the drug and then you decide to stick with it. So that is an important consideration for patients. But I think when patients want to start thinking about changing the therapy is when they realize that either the drug therapy is not working as well. I think also there's an evolving principle here where we want to recommend, I think neurologists in general and the MS community in general believes that one should treat the MS disease as aggressively as possible within the parameters of safety and benefit risk balance that a patient will set. Yeah, well, one of the things that helps Biogen differentiate itself, and I think demonstrates its leadership position in multiple sclerosis therapeutic development, is the fact that Biogen has several drugs with different mechanisms of action, both on the market and actually in development. And we have a treatment philosophy, which I think we share with many, which is that patients should be on the right drug at the right time. And we also believe that cycling, making ill-informed or cycling from therapy to therapy to therapy, as you outline, is not the best place for a patient to be. And so we're actually investing in research and discovery around tools that allow patients and physicians to make the best possible decisions about switching therapies. And obviously, when we talk about our portfolio of compounds, we have Tecfidera, we have our interferons, Avonex and Plegridy, we have Tysabri, and those therapies all have different mechanisms of action. And so selecting the optimal drug therapy and the mechanism of action is something that we believe should be supported, and we actually believe that we create that choice for patients.